Welcome to season 2 of the Happy Sensory Corner podcast. At Mendability, as we know, we want to help everyone, but especially when they're vulnerable to feel happy, more comfortable in their own skin, more confident, so they can be their true selves. And as our brains grow stronger, healthier, all of us benefit, but especially those among us who might struggle with sleep, anxiety, sensory overload. And so we developed a gentle, family-centered program of whole brain games that boosts brain development and activates the brain's self-healing mechanisms. And it's based on the science of environmental enrichment, and we call it sensory enrichment. So the body has this remarkable ability to heal itself. And we take it for granted that if you cut your skin, break a bone, you just pretty much have to put a bandage over it and let the body do its thing. And then days or weeks later, everything's done. So we're focused on the brain's ability to heal itself through, organized, novel experiences. But there is more. And today we're going to learn about another part of the body. And I'm not sure how to introduce it properly, so I'll let our guest do that. But believe me, it's going to blow you away. So let me introduce our guest for this week. Dr. Satya Sardonicus is a chiropractor and a specialist in the neurobiology of stress, who has dedicated her career to helping individuals stuck in chronic fight or flight mode. Do you like how I'm planting the seed for that, Tatya?
I do.
Especially those who've been told that their conditions are unsolvable. So she's the developer of the facial, how do I say that?
Fascial.
Fascial? Fascial,
Mhm.
okay. Neurofascial flow method, because we're talking to talk about fascias, right?
Exactly.
A
Not facials,
ground.
although those are lovely too.
So this is an approach that empowers the body's natural ability to heal, just like ours. Her method has already made an impact with published studies, which is very important in my mind, demonstrating significant improvements in pain, sleep, cognitive function, anxiety. But here's what's remarkable. This work stems from her personal journey. And Dr. Satya faced years of debilitating symptoms from traumatic brain injuries, other chronic illnesses, before finding her way to recovery by turning inward and rethinking everything about how the body heals itself. So I'll let you start your story, Satya. I think it would be a lovely way to introduce us to the issue and to what we're going to talk about, and then we'll go into things like vitalism, bio-tensegrity, and a whole bunch of words that I didn't know existed until I met you.
Absolutely. Well, we'll talk about what those are. I always I feel like when I'm a patient, I wish that doctors would explain to me better the reasoning behind what they're doing and help me understand more about my body. So that's something I always feel deeply committed to doing. And I will use the more complex terms because I think you're smart enough to understand them. It's just somebody needs to explain it. And I'm happy to explain. Uh, because I don't want anyone to blindly listen to me or anyone without it resonating with your own internal sense of this makes sense. This is something that um that I understand. I don't think that healthcare should be, relegated to somebody on a mountain in a white coat. I know I'm wearing kind of a white coat, but not white. So yeah, I am happy to share a bit of my background. I'm as as is very aligned with what you shared. I'm super driven by the not just the belief, but the knowledge that the body has an incredible capacity to heal when we create the right conditions for it. So I was raised in a family full of holistic healthcare providers who taught me the body is self-healing, self-regulating, and the same intelligence that took you from a fertilized egg to trillions of cells that all know how to do their job without anyone telling them what to do, least of all the doctor. That same intelligence is still working to be self-healing and self-regulating throughout your entire life. And so many people I've worked with over the years feel really stuck, and it's like they've tried everything and still don't have answers. But I think it's because the providers are asking the wrong question. They're trying to say, how do I fix XYZ symptom, or how do I deal with this diagnosis, as opposed to, well, why is the body not functioning normally? Because it should know how to function normally. And so it's like everybody lives on the spectrum from 0 to awesome, where you're dead or fully alive. And it's like symptoms are kind of the lower half of that. And there are a lot of both Western and more traditional and more holistic approaches that are aiming to help people get out of the symptom zone. I'm honestly more interested in, how do we get you to your optimum? Because so much of the time, it's like, if somebody's missing an arm, maybe now they can do 90% of what somebody who has all their limbs could do. But maybe they're functioning at 60%, and most doctors look at them and say, well, that's because you're missing an arm. And that happens so much with kids who have diagnoses of autism or other diagnoses on the spectrum, or dyslexia or schizophrenia, like all these different diagnoses I've seen people come into me with, that so much, like 100% of their challenges get blamed on that diagnosis, as opposed to saying, well, what's the optimum that you could be functioning at, regardless of whatever diagnosis you have?
Was
I
there something that
I'm gonna let you talk.
no, no worries. Um, uh, it sounds like there's, in your youth, something that planted a seed for where you're at today. You said you were surrounded by holistic doctors. Can you explain what that means?
Yeah.
And then what happened with your traumatic brain injuries?
So my dad is a chiropractor, as are 5 others in that generation. So I have a bunch of aunts and uncles that are also chiropractors. And my mom is a craniosacral and yoga teacher and movement therapist. Like, my godfather was a rolfer before he became a chiropractor. My godmother was actually a nurse and then also studied like raw foods and just all these different acupressure. Like, they've all studied so many different modalities. And so that's kind of what I was just steeped in growing up. I'm the oldest of 6 kids, and none of us ever even had a Tylenol growing up. I mean, if we were sick, dad adjusted us, but like, I think one of my siblings maybe woke up in the night crying and pulling at her ear, and my dad adjusted her neck, and then in the morning that she was fine. That's like the closest any of us got to an ear infection. Or, when stuff was going around school, we didn't get it. And I just took it for granted as a kid, as you do, because that's your whole world. And I got older and I was like, oh, people don't take care of their bodies in a way that is like, let me support the body's self-healing function. It's more, oh, I have a headache, take a pill. I have this symptom, take something for it. And even there's like, in the more holistic world, people are doing plant medicine for different things, which I'm not opposed to any of that. It's just that it's like we're skipping to the micromanagement of the body, instead of just starting with the foundation of like, hey, from my dad's chiropractic perspective, is the brain body signaling working? Like, is the spine interfering with the messages between the brain and the body? Because that's pretty crucial. Are you getting enough sleep? Are you drinking enough water? And there's a lot more shift happening towards that kind of baseline foundational approach these days, which is so cool. But that was definitely a thing that made me feel very like an outsider as a kid socially, because it wasn't normal back then. But that laid the foundation for when I started having some pretty challenging health issues. That's what I leaned into. So when I was 7, I was in a car accident in the middle seat of a pickup truck. So I just had a lap seatbelt, and we were stopped at a light and rear-ended at about 50 miles an hour. I had 3 herniated discs in my neck and 1 in my low back at 7 years old. Because of my family full of amazing chiropractors and osteopathic and craniosacral, like all of these therapists in my family, I recovered pretty quickly, or so we thought, and was kind of a very high needs child. I was often called precocious, but also I preferred to be with adults. I was really sensory sensitive. I didn't like loud sounds. I was more quick to anger than my siblings. And this is interesting because my dad and I were talking about it recently. We thought I had no symptoms of head injury until I was 16 when I was in a small car accident. And I started getting headaches and dizziness and nausea. And like I needed to sit in the front seat of the car. My siblings just thought I was faking and wanted, to sit in the front seat, but I would get super nauseous. And those symptoms progressed to get much more dramatic. By the time I was in my late teens, I started having visual and auditory hallucinations. They thought I might have schizophrenia because that's about when it starts. I started getting electric shocks down my arms and legs and muscle weakness on the left side of my body and twitches on the right. My heart rate would go crazy. Now I know if I had gone to a medical doctor back then, they probably would have diagnosed me with POTS, which is when your postural changes trigger major heart rate dysregulation. It's a kind of dysautonomia, which is an dysregulation in the autonomic nervous system, which is that fight, flight versus rest, digest. But back to our recent conversation, he was like, actually, you probably did have symptoms. So we think my brain actually got herniated out of my skull in that car accident when I was 7, but nobody knew until I was 26. I was misdiagnosed with, they thought maybe I had MS or heavy metal poisoning, fibromyalgia, like chronic fatigue. Nobody could really put, like I said, schizophrenia, like nobody could figure out my symptoms that were just getting worse and worse. But I had multiple head injuries during that time in my life. I had a skiing accident. I was playing tag with my siblings, running really fast and hit my head and got knocked out for a few seconds. Like things that oftentimes we don't think about. It's like, oh yeah, I had some injury and I was sent back out to play. Or maybe you go to the hospital and they say, oh, you have a concussion, go home and rest, right? They don't do much about it. But those additional head injuries, now we know were actually worsening this brain injury that I had gotten when I was young. But the symptoms we realized recently, my dad and I were talking, and he's like, actually, we thought you were just a controlling kid. We thought it was your personality. And now on reflection, we realize you had all of this sensory processing dysfunction and like hypersensitivities and need to want to control everything around your environment because I had a brain herniation, which sounds crazy, and it is crazy, but it's actually really, really common and it gets missed a lot of the time.
So 26, you finally get some clarity about what had happened.
Yeah.
At what point do you lean into vitalism and bio-tensegrity?
Yeah. So, well, those are two different pieces, but I'll speak to both of them. So, vitalism is just this philosophy that says the body is self-healing, self-regulating, and it is in contrast to allopathy, which is what Western medicine functions on, and so does a lot of holistic care as well, which is
Mhm.
the management of symptoms and illnesses, disease as an entity. I always appreciated the chiropractic writing of that word as dis-ease with a hyphen, that it's not this thing that jumped out and got you. It is an imbalance. It's dis-ease in the system. So vitalism, it's like most people I've ever met that have come to this place of saying, yes, the body's self-healing, self-regulating. We need to support the natural mechanisms of the body for it to be able to heal itself and the brain. Most people I've ever met with that came to that at some point in their lives. I was just raised with it. So there's no question in my mind that when I finally had this diagnosis and the solutions suggested to me were surgical, to either cut off that part of my brain like I don't need it, or cut off the back of the skull to try to decompress it, or there's one surgery that a lot of people like to do in Barcelona where they go and cut the attachment between the spinal cord and the tailbone so it doesn't pull.
Hmm.
And I researched all of them, but because of my background in vitalism, like even though, I mean, I was used as an example in all of my neurological diagnosis classes of like what pathological reflexes look like. Like I was a disaster. When people asked me about my pain, I would tell them it was on a scale of 1 to 10, 25, 24 hours a day for years. I share this to say, like, I should have been really motivated to say, yeah, let's do surgery. Yeah, let's do something like something extreme. But I researched the outcomes and they're not that great. Um, they're temporary. Sometimes they help some and then they get worse. And I said, well, how do I, if I didn't have that strong foundation in vitalism, I probably would have done that. Except I said, no, how can I do this non-invasively? And that's what led me into the world of fascia and bio-tensegrity, which is this concept that says bio-tensegrity is actually an adaptation of an architectural principle. So houses are what's called a continuous compression structure where the rigid parts are resting on each other. And that's what we're taught in school, that the support structure of the body is the skeleton, the bones, and then the muscles move it. And fascia is just kind of something you cut out of the way to see the real stuff on a cadaver or something. And in contrast, the body is actually not that kind of structure because a tensegrity structure, this is not body yet, just tensegrity is architectural principle.
I see you looking to the side. Do you have that
I'm
prop that you
looking,
used when you're trying
I
to
do, I
explain it
have
to
a
me
model.
earlier?
Yeah, I do.
Yes.
Thank you. I was like, where did I put it? I have a whole bunch of them. So you've probably seen something like this, like a little kid toy,
Yeah.
where the rigid pieces are not touching, they're not resting on each other, but they're connected by a continuous piece of elastic. And that elastic is maintaining what's called the tensional integrity of the structure, which is why it's called a tensegrity structure. So when external force comes in, it distorts across the system because it's dispersed across all of the elastic portion, and then it comes back to center unharmed when the force is released. Now, when that's applied to the body, we are at all levels actually a tensegrity structure, from the cellular level with the cytoskeleton up to the muscles with there's actin and myosin crosslinks. Like, it's okay if somebody doesn't understand that, you'll get the vibe here. But even at the big level, the rigid parts are our bones, and the elastic is the fascia with all of the muscle invested and entangled and meshed suspended in it. And so that spider web like material in the body has some elasticity to it, and that fascia is actually what holds our body in relationship to itself. So if you were to look at an x-ray of a knee and the bones were touching, that would be horrible. That'd be grinding. Like, that's not what it is. And there is some force that gets dispersed vertically, like through the joint space, but for the most part the fascia is actually what is the scaffolding of the system. And the only reason I really started to understand that is because I was trying to figure out, how do I mimic the surgical results for this specific brain herniation where the brain gets herniated outside of the skull. And I was like, well, if they're trying to release spinal cord tension, how could I do that working on the fascia? And I looked at where the fascia connections are in the body, and then I just started experimenting with different kinds of manual therapy. But the biggest overlap for me in like early clinical practice is I had just been diagnosed. So I was diagnosed a few months before I finished my doctoral program. And I started like experimenting with a colleague of mine who was a craniosacral therapist before coming to chiropractic school. And we tried all these different kinds of manual therapy to reduce the squishing of the skull, reduce the pulling on the spinal cord. And we were just coming at it from that structural perspective. But I had been doing my postdoc while I was still in my doctoral program on the weekends because I'm an underachiever. Um, and so I was mostly through my pediatric and prenatal postdoc with a specialty in sensory processing and integration. So I was even in my residency working mostly with really complex neurosensory integration challenging cases. And what I noticed was that these kids I was taking care of, and their stressed out parents taking care of Heine's children, and me having had multiple head injuries, we had a lot of overlap of our symptoms. And that's what brought me into that understanding of the dysautonomia of the chronic fight or flight. It's also called sympathetic dominance because it's the sympathetic arm of the nervous system. Um, and
So
and
this is
saying,
where you connect
this is where I
fascias and neuros. So that's why you called your program the
the
neurofascial.
neurofascial. Yeah.
Yeah,
So
so this idea that the brain is being is affected. And I'd love for you to talk about that, this idea of this chronic alarm mode, or the alarm mode when the fascia are in tension, out of line, how this is affecting the nervous system. Is that
Yeah,
when you started putting all of this together?
I started to. I think at that point early on, I was still thinking structurally, not totally separate from the neurology, but I was like, okay, so how does the brain get out of alarm mode? It gets out normally, like if you smash your finger on the door, you want to shake it, you want to squeeze it, because both movement and deep pressure send what's called proprioception or proprioceptive feedback to the brain. That is in contrast with the nociception or alarm signals that went when you smashed your finger. So proprioception is actually the brain's normal way of recovering from a nociceptive or alarm trigger. But in I was like, well, why are we all stuck in this? And for me, like I had had physical injury that was mechanically sending alarm signals, but alarm signals can come from a lot of different places. They can come from emotional stress, which is the thing people think about the most when you say stress. They can come from chemical stress, like having inflammatory foods in your diet, or chemicals in your, personal care products in your environment, things like that. But what I realized was the most overlooked source of stressors was the structural, was the neural, was the physical. And with my background in chiropractic, I was looking a lot at the spine because it has the highest density of proprioceptors in the body. So if there are jammed up joints in the spine, that can compromise the brain's ability to recover from any new kind of stressor. So normally, just you move your body around, it's even in the term fight or flight, both of those have movement in them. So movement is normally how we would recover from stress. But if you have joints that are stuck, and now what I realize is also if you have fascia that is sticky to itself or the surrounding tissue, then the proprioceptors that are in the fascia and in the joints are now not firing to the brain. So your brain is starving for proprioception, which means it has to handle all incoming stressors of any kind, physical, chemical, emotional, with one hand tied behind its back. And so it puts the brain at a disadvantage. It puts the nervous system at a disadvantage to be able to handle new stressors. But adding insult to injury is that those places are instead sending alarm signals. So 24 hours a day, even if nothing ever stressed you out and you had the perfect diet and you got enough sleep and you felt really connected with your family and supported, and all of these things that we usually think about with stress reduction, if you have any jammed up joints or you have any fascial adhesions in the body, then your brain is getting alarm signals 24 hours a day, pushing it into and sustaining a chronic alarm mode. And I say alarm instead of just fight or flight because when you've had either extreme or chronic stressors, then the system can even go past fight or flight into what's called a dorsal vagal collapse or shutdown, kind of a functional freeze mode. And I see it mixed. This is from polyvagal theory, if anybody wants to learn more about it, from Stephen Porges. But it's this idea that we go past fight flight into freeze. It's like an animal wanting to play dead. And what I've seen oftentimes is kids and also parents of these high needs kids, because of the chronicity of the stress of the situation, kind of going between, oscillating between fight, flight, and functional freeze. And so you're kind of numb and disconnected, or in a really intense, like combative space, um, or depressed or anxiety. There's just a lot of different symptoms that can come along with those things that are usually treated as separate symptoms, but it's actually all one thing. Where if your brain thinks you need to fight for your life to survive a tiger attack, it's normal to have more anxiety, more depression, more aggression, less compassion. Your ability to understand another point of view is actually neurologically suppressed when you're in alarm mode. You're going to have a decreased priority on growth and development. So in kids, we often will see like failure to thrive, really underweight, not absorbing nutrients. Not always, but this can happen. In adults, we often see slow wound healing. We'll see a deprioritization of fighting things like infections and cancer, and instead extra reactivity in the immune system to allergens. So you might have more asthma, allergies, the itchy, sneezy, wheezy, allergic type responses like psoriasis or eczema. And so it's like we're often treating all these things as separate, but I actually have a
It's
checklist. If you want, I
yeah,
can
it's
provide
funny.
it to
The
your
list you
people of
just
like,
made
yeah.
is the same list that serotonin manages. Did I right, Claudie? Is that what you were thinking when you were listening when she was talking about anxiety and stress and then the immune response and failure to thrive? When we, you know, before I learned about neurofascia and and the importance and this idea of a chronic alarm mode. Claudie, what questions? I feel like there's a lot of overlap, so I'm trying to say, is this a chicken and egg? Is this the chronic alarm is depleting serotonin levels, and therefore the stuff that the brain uses serotonin for are being affected, or is this? I don't know how, Claudie. I wonder if.
Yeah, it's definitely it looks like two ways of looking at what is going on. And on our side, we work on helping the brain do a better job and definitely improve the function of serotonin and dopamine. And we see the results expanding towards the issues that you are mentioning, like decrease of anxiety and sleep returning. And so I'm listening with great interest, of course, and please
Can I
continue.
ask a question? I'm
What
curious, how are you, when you say that you're addressing it from the neurotransmitter perspective, from the chemistry, what are you doing to help the serotonin
Okay, so
replenish?
we use so environmental enrichment is knowing what happens to you when the environment is used the proper way. I would say the environment can be a situation that is already there and doesn't systematically work for you, and we introduce the knowledge of neuroscience to say, well, for example, if there is a pleasant scent nearby, your brain will produce more dopamine. There are reactions of the brain that we know that's been measured, and then we would trigger them and invite the brain. And everything in Mendability is extremely gentle and also very short. Like most of our exercises would last a minute and a half. And
Mm,
I have one element here that I would use for myself to make life really more effective and my mood being better is
so using
smelling an
smells.
aroma.
Yeah,
Because
I love that.
olfaction will increase the production and
Yeah.
the release. When you smell, your brain is going to produce 100%, well, release 100% more of the dopamine, this wonderful hormone. But if you do it on a regular basis, then your brain is going to start to produce it more and more.
Mm,
So
yeah,
we
I
see
love
the
that.
kids or the adults feeling better. We use touch in a different way. We use soft touch, which is the touch of a mom, like a
Yeah.
gentle stroke. And working with children with autism a lot, we see that they don't respond to gentle touch in the same way that the
There's a lot
typical
of
people
sensory
do.
reactivity. Yeah.
Exactly.
Yeah.
But so we go very progressively. We start by inviting them to touch interesting textures with the tips of
Mm,
the fingers because they are not.
yeah.
And so gradually get their brain accept soft touch as being a friend. So yeah, the neuroscience has told us how the brain will do with elements of the environment and we organize them so they happen and yeah, we basically talk of the issues in the same way. We know the same kind of problem that people can have to be very miserable, and we have
I
the
have a
brain
question.
in a different way. Yeah.
I wonder, sometimes our clients hit a bit of a wall or a plateau and it's a bit difficult to get past it and you say, you know what, let's introduce some things like intense physical exercise to increase the oxygenation of the brain, but also induce support that the neuroplasticity, because intense physical exercise has been shown to intend to accelerate brain recovery and stimulate those same self-healing mechanisms that we see with sensory enrichment. And I wonder if the motion involved in those intense physical exercise is affecting a little bit the fascia, and maybe so now that you know how we stimulate serotonin, or help the brain regulate its chemistry, and that has an impact on the brain functions that are involved. How do you support the same functions? How do you support sleep,
Yeah,
for
thank you for
example? How
helping me
would you do?
understand that. I think there's a lot of, you said something about like the different perspective or approach to it, and I often think about there's many different colors of sunglasses that I can use to look at the same situation, and that's why my dad always encouraged me to learn a lot of different methods and techniques and approaches, because different people will need different things even on different day, like the same person will need different things on different days. And it's really powerful to have a rich and nuanced toolbox to be able to help somebody's nervous system come into a place of safety and self-healing. And there's psychological safety, there's sensory safety, there's somatic safety. And a lot of the somatic safety is where I've leaned into, just because I find it missing, a missing piece from a lot of approaches. It's not meant to be a panacea by any means. Nutrition is hugely important. Sensory environment is hugely important. And it sounds like you guys are doing some really powerful work that is super aligned. This is one piece that I might suggest to could be incorporated, which is the proprioceptive piece. And proprioception is coming from the joints and from the fascia both. So the proprioceptors function like the body's sensory antenna. There's these rich nerve endings that are constantly communicating with the brain. So when
Oh,
fascia,
oh,
oh, go ahead.
Yeah.
sorry, I was gonna maybe save you some time. We Claudie was focusing on the senses like smell and touch, but we
Mhm.
we do work with the vestibular system when we want to talk to that brain function. We do stimulate proprioception, for example. We do some well, Claudie, you can talk about it more than we do.
No, you
I
can.
would like to hear more. Because I think our audience are familiar with the sensory piece and the proprioceptive piece, and they're probably like, yes, yes, yes. But
Got
tell me
it.
more about neurofascia. Tell me
Oh,
more about how, for
got it.
example, you talked about the fascial adhesion,
Yep.
and that's something that I'd like to learn more
Thank you
about.
for that refinement. I will zoom in on the fascia piece specifically. So, probably the most potent thing I can share is about a specific structure called the dural fascial kinetic chain. So, the dura mater, which means tough mother, is the fabric-like lining of the skull and spinal column, and it protects the brain and spinal cord. And it is actually a very dense, specialized fascia, and it is sort of glued to the inside of the skull. It's contiguous with the inner layer. It's called the periosteum on the outside of bones. So it's contiguous with the periosteum on the inside of the skull, but in the spinal column, it's more like a sleeve. It's not glued to the bones. And there are attachments in the upper neck and also at the tailbone. It's also connected with the fascia that goes in between the ribs and the diaphragm and other structures as well. But the vertical kinetic chain or movement connection is to the tailbone and then through the what's called the sacrotuberous ligament that goes from the tailbone to the sit bone, the ischial tuberosity. And then there's fascia that runs down the back of the legs and into the plantar fascia of the feet, which is what people have often heard of if they haven't thought about fascia any other way, is you go, oh, I've heard of plantar fasciitis, which is an inflammation of the fascia on the bottom of the feet. So this dural fascial kinetic chain acts like fabric. Like if you pull on the edge of a bed sheet, it puts tension across the entire bed sheet. So if there's tension anywhere in the skull, if there are imbalances in the skull, like the cranial bones are supposed to move just a little bit so that the fluid can flow
Like you
around.
had whiplash, or
If
for example.
for example, birth. I mean, I've attended a ton of births, and there are a lot of times that the baby gets twisted or pulled, and it doesn't get classified as a traumatic birth. But having attended them, I would call a lot of births traumatic on the baby's neck and spine. And so that's often where these issues stem from. And even before that, if mom's pelvis was twisted in not early in pregnancy, but in the third trimester when the baby is bigger, if mom's pelvis is jammed up twisted, then the baby's sitting in there twisted, and the fascia patterns will actually start to develop distorted. And you can see images when Rolfers have done a lot of this kind of research. They're focusing on structural integration. It's a kind of body work that is all about fascia. Although I will say, I love a lot of what they do cognitively, but I find a lot of it too aggressive for sensitive nervous systems. So I've modified a lot of fascial therapy from what they do. But anyway, they've done these cool studies where they look at babies where they were sitting in utero. You had like an ultrasound or something. You could see how they were twisted, and then you look at their posture as adults and they still have those distortions if nobody has ever done anything about it. It's this very like, as the twig is bent, so grows the tree concept. And it's why I learned how to adjust pregnant women, not because it helps them feel better be more comfortable during pregnancy and labor and delivery go easier. Those are nice, but it's because the baby's spine and fascia system are first affected in utero. And if there's any constraint, that can actually affect how their body holds tension in the future. And if it's holding tension as you grow, I mean, you're learning to walk, you fall down. It's like more than 50% of kids fall from a high place in their first year of life, babies. And I always give that statistic before I ask parents, so has your baby fallen? Because it's terrifying. You don't want to admit it, but it's actually very common. And then they're learning to crawl, falling down, learning to walk, falling down, going out in the jungle gym, falling down. We get all of these just bumps of life, even if they don't have some major car accident like I did. And that causes joints to jam up, and most importantly, causes the fascia to splint. The brain uses the fascia protectively to brace itself when it can't figure out how to process some kind of input, whether that's a physical injury or emotional stress, where we want to go into like a protective mode because mom and dad are fighting, or they feel bullied at school, or whatever stressors emotional stressors can turn into the fascial adhesions, especially in the rib cage. It gets gluey to itself. And I think my theory is that that's because the brain is trying to protect vital organs when you're in chronic stress, when your brain thinks that you're in danger a lot of the time. And this happens even to the very best of parents. It's not, if I want to be very clear, it's like no blame on the parents. They're always doing the best they can with the resources they have available. But it's really common for kids to come in to see me who have these neurodevelopmental challenges like autism or ADHD, where they're stuck in chronic alarm mode. I'm thinking of this one boy who came to see me, little 10-year-old kiddo on the autism spectrum, who had been actually asked to leave his special school because they couldn't even handle him there. He had a lot going on. He'd been under OT care for about a year with successful results according to their metrics, but the owner of that OT clinic called me about a month into taking care of him, and she said, "What OT have you been doing with him? Because even though he's done pretty well over the last year, in the last 4 weeks, he's made more progress than he has in the last year." And I said,
Which
I
is a
haven't done.
perfect segue into my next question. I'm dying
Okay.
to get some like practical, like, is there something that you can do yourself to kind of stay when you've been talking about this, I've been looking at yoga as a way to sort of keep the fascia loose and bringing some tension and let it sort of spring back into the right shape. That's what I'm sort of
I would love to
preparing
share
myself
that.
to hear, and I
Can
wonder
I,
how.
Kim, can I just finish my thought really quick? Because
Sure, go ahead.
I wanted to just share that piece, but I will tell you what I did with him and what people can do on their own. But they're not precisely the same, and I just want to be really clear about that. I think it's important for us to have our expectations managed appropriately, if that's okay with you.
Yes.
Okay,
Yeah, I
so
thought the story was going to be the perfect segue. So I want you to
it will be.
emphasize
I
what it
feel
is
your
that you did.
excitement. It will be a great segue for that. So what I shared with her is I did not do any OT exercises. All I did was things to help his nervous system come out of alarm mode, because one of the things that happens when the brain is in alarm is that it deprioritizes development and learning new things. So that little boy, after I think 8 weeks with me, was reintroduced to public school He started to suddenly understand fractions and math. I didn't do math exercises with him. What we did was, one, proprioceptive feedback. Two, that's only going to, the proprioceptive feedback is just there to get you a window of access to release whatever's stuck in the body. Because ultimately, if there are stuck places, I told you 24 hours a day, it's still sending alarm signals. So proprioception is like a supplement, basically, because the brain is starving from the stuck places. So we can feed the brain extra proprioception. And that's something like I usually teach people what I call squeeze hugs. It's these broad, deep squeezes that you can do anywhere on the whole body. You do my hands because they're easy to reach here, but my hands, because there's proprioceptors in the joints as well as the soft tissue. These broad, deep squeezes, you can see that my voice tone slowed down and dropped. I didn't do that on purpose. It's actually that fast. I was getting a little buzzy and excited what I'm talking about. So that can help people interrupt like a meltdown that's happening. Kids with a lot of sensory sensitivities may or may not like deep pressure, although I will say that deep pressure is often much more calming than light touch with sensory sensitivities. So it's something that can be tried, but also teaching them to do it to themselves, because oftentimes having an outside, like self versus non-self, can feel unsafe. And oftentimes kids are not given as much agency over their bodies, especially going from specialist to specialist. So teaching them to do proprioceptive feedback is great. That's also like the same science as the vibration plates, which can be overstimulating but can be helpful. You have to modulate by person. But the fascia pieces is what I found needed to be done before going to chiropractic adjustments. But I will also say that chiropractic adjustments are often necessary if there are jammed up joints, like from birth, from falls, from things like that. And so usually what I'll recommend is for people to do some gentle fascia work on yourself to reduce the tension on the spinal cord through the neurofascial kinetic chain. And I'm happy to explain that in just a second. And then see what kind of comes out in the wash. Give it a month or a couple months of doing these exercises to reduce the fascia tension. And then you may want to see a chiropractor who is specialized in pediatric sensory processing, because it's adjustments are very different than they are for adults. But that's another piece that's really huge and should not be overlooked. But I will say that the fascia stuff, I think makes probably 50 to 70% of the difference. And the idea is that if there's this tension throughout the neurofascial kinetic chain, then it's putting extra tension on the spinal cord and mechanically irritating the nervous system. So it's like pulling my stockings up. Like if I tried to pull them up from the waistband, I'd put a hole in it, it wouldn't work. I have to like start down by my feet and feed the length upward, right? I will usually suggest that people can try doing some like gentle loosening of the joints in the feet, like wiggling them around. Just go like look at a picture on Google of where the bones are and just try and loosen them compared to each other, like wring the foot out like a sponge. It's very, very gentle. And then trying to break up the fascial adhesions. There's often stickiness in the calf muscles. And then like pulling stockings up, there's some ways to feed the fascial length up. I always struggle with how much to like demonstrate and share of those things on these calls, because I want to give people things that you can use right away. And also, especially with these challenges like autism or ADHD or any sensory sensitivities, it can be too much. And there's this struggle that I have with a lot of kinds of manual therapy in the world, is that they're all focusing on let's make a change happen. And there's not enough focus on the container in which change happens. And if the system is even ready for that change, and looking at that change receptivity is huge. So starting with, excuse me, my puppies are having a little time here. Hey, chill out. starting with establishing safety, and the environmental safety is huge. So like all of these different ways that you are that your program has developed are so cool, because that's what is going to give that container of safety. And I encourage people to then check, like I'll show you an assessment you can do right now if you'd like, to see
Yes.
how is the spine articulating, because that's the highest density of proprioceptors. So what you do is, I'm standing right now, but this can be done standing or sitting. You don't have to get up. You're going to imagine that you're like seaweed underwater, and you're planted in the sand, and you can breathe underwater, so don't worry. And you're between two panes of glass so that you can only move sideways. You're not going to move in the front space. It's just side to side.
Okay.
And you want to see if you can let your spine articulate from side to side all the way up so your head is the last thing to go. And relax your shoulders. And if
Kind
this
of like
bothers,
the soccer wave thing.
yeah, yeah.
Okay.
If this bothers anything or elevates your heart rate or irritates any symptoms, then try going smaller or smoother, or just don't do it if you can't, because everything I always teach wants to be somewhere between neutral and awesome. Like, we don't want to aggravate the nervous system when we're trying to help it. So what we're trying to do is say, can you articulate smoothly? Or what's really common is from about the lower neck to the upper, like the stomach area, basically your rib cage often is gluey to itself, and so that wants to move as a single unit, and then your head wants to flop. Don't let your head flop. What's happening there is, if you have a lot of fascial rotations between the ribs, then you probably aren't able to take a full deep breath out to the side. Like, you can even try putting your hands on the side of your rib cage and take a deep breath and see, do you breathe out into your hands, or are your neck muscles lifting your rib cage to get the lung inflation? That's really common. And then you
So
have
it seems like
chronic
I'm pretty
neck tension.
loose with the stuff. So
Good.
if you were doing with a kid, what
Yeah.
would that tell you? What if there was
I would be
um
looking to see
less
what the articulation
flexibility?
is really specifically in there. And then if I'm not seeing smooth fluid articulation, I would try to loosen up the fascial adhesions with some fascial release in the rib cage, if it's accessible. The first thing I always teach people is how to tell if your nervous system is going into alarm mode or not. And this is something I'm happy to take you through right now, because I think this is probably the most powerful thing I teach, which is, you can modify literally any technique that you ever learn by knowing how much change can I do without triggering my nervous system into alarm. And you can teach your children how to do this, and you can learn to feel it. I teach providers how to feel it in someone else, and parents how to feel it in your children, by putting your hand on them while they do the exercise. This is obviously not, you'll see, it's not going to be appropriate for all developmental stages, but it can be modified, and you can practice it on yourself so that you can
Yeah.
learn what the sensations are, and then you'll be able to help your children more as well. So this is helpful, like if you're trying to do any kind of new therapy or technique, to make sure that you're not exceeding the nervous system's capacity to integrate that change. Would you like to do it?
I'm drum rolling in my head right
All
now.
right, all right. So this is emotionally intense for about 15 seconds. If somebody is feeling particularly fragile right now, save this for later and do it at a time that you're feeling a little better, but I promise we will leave you in a good place. So close your eyes. Take a moment to just scan through your body and notice how you're feeling, because you've been living out here in the world with us, thinking about all of the things. Notice, what is your heart doing? How does it feel in your chest, in your jaw, behind your eyes, in your low back? Just take a little scan through. And then I want you to think of a time in actual memory when you felt attacked or made wrong, or like who you are is not okay. An actual memory. And I want you to go into that memory just for a few moments here and be in that time where you felt made wrong, like who you are is not okay. And I want you to notice what's happening with your breath, what's happening with your heart. How does it feel in your stomach, in your low back, in your tongue, behind your eyes? Take a breath, give yourself some deep squeezes on your arms to kind of reset. Close your eyes again. Think of a memory an actual time when you felt really celebrated and loved and proud of yourself and connected. Be in that actual memory and scan through your body and notice. How's your posture? How's your heart? How's your breathing? What does it feel like in your jaw? Blink your eyes open, come back together. If you're open to sharing, what did Kim and Claudie, what did you notice in the first exercise? What were the physical
Uh,
sensations in your
it was
body?
more like a compression of the
Mhm.
chest.
Yeah. Yeah, compression. I often feel like more shallow breath, like it's harder to get a full breath. My heart goes faster. What did you notice, Claudie?
I have to be honest, I was observing.
Oh,
I didn't want to miss anything, so I was
oh,
observing what was going on.
all
And
right.
I have
You'll
a
do the
question.
exercise later.
How does that work with kids? I mean, because basically you're doing this with them and you want to make sure that you're not doing too much or too little.
Yeah,
And to us also, it's very important to hit that sweet spot in the middle where not enough of an experience and we're not inducing that change and the brain is not going to change its
yeah,
structure as a result, or too much stress and then now you're in stress response mode and there's no growth that's going to happen. But
yeah.
so there's that sweet spot there. So I'm
I
really
actually
interested in knowing
usually,
how you can observe that
yeah,
into in a child.
I actually usually will ask the kid when they're already having a hard time. I don't bring it up. I don't say, hey, let's go into this exercise. I notice when they're having a meltdown or like starting to, like obviously if they're in a full meltdown, you're not going to get much communication out of them, but you can ask them how they're feeling when they're feeling stressed. Like, oh, they don't like something that's happening. And I'm like, okay, what are you noticing? What's your heart doing? What's your breathing? How do you feel in your body? What's your body telling you right now? So you can capture a time when they're already having a stressful situation and use that to help them notice what their body is doing. Um, but also, you can teach them to notice that there's that overall pattern of constriction versus expansion. Like in the second one, what did you notice, Kim, in your body?
Um, yeah, it was that compression was going away.
Yeah. Yeah, there's that release and that more openness. And it's interesting. I always, teach adults to be able to do this, to find the nuance in your own body, because also you mirror with your children. And so you will often, as a parent, feel in your body the constriction signs because of the mirror neurons in your brain when you observe your child's nervous system going into alarm. And it's something that we as providers can cultivate as well. Like I can tell if I put my hands on somebody, I can feel it. But even if I'm just in the same room, I can feel what's going on because our sensory systems aren't just requiring,
Hmm.
extreme proximity, right? So that's why a lot of the time with kids, I'll have parents learn to do this for themselves and then start to notice it. Like the more you practice noticing it in your child, you can see what happens. You can see what's happening with their breath and what's happening with their, like they might get more agitated and want to move their body more. Like there's different signs, sort of tells that the body uses in different people. There's an overarching theme, though, always of constriction versus expansion. And a really simple thing, if you can't, if they're like pre-verbal, is you could put a pulse oximeter, which you can get on Amazon, just tells you their heart rate. You can just watch their heart rate while you're trying to do a kind of a therapy. And if it's elevating their heart rate, more than dramatically, if it's elevating it
Yeah,
more
that
than
sounds a lot more refined. Claudia usually, to tell them the surefire way to know if the kid is under stress is maybe some flushing in the ears or the cheeks, but also check their heart rate. But I can never pick up the heart rate. I don't know. I'm pretty bad
Well,
about it.
that's
But
why I
like a
like the
little,
pulse oximeter because it just tells
yeah.
me it's like just on their finger, you know. And again, these things are, these are ideas that you can use. I don't really have explicit protocols because I don't think protocols work. You have to be able to accommodate to the human in front of you. So these are like different ways that you can think of how to track that. But like I said, you can also learn as the provider to be really sensitive to noticing if somebody's nervous system is going into
I think
distress.
it's a huge takeaway. I love this.
Yeah.
If if we wanted to end on a high note, or maybe if there's one thing that you want every listener to take away from this episode, what would it be?
I wish that everyone would understand that when the nervous system is stuck in alarm mode, it can really block your progress in other therapies, no matter how good they are. And um, that can be sustained by structural stickiness, stuck places in the fascia and in the joints.
Mm.
And so, whether it's occupational therapy or speech therapy, or even learning in school or going to psychotherapy, all of these things are going to work a lot better if you make sure that the structure of the body is signaling safety to the brain. And when the body has that somatic safety, it helps with the sensory safety and the ability to actually grow and learn and heal itself. It's like clearing the static from a radio signal. It allows the brain to process an integration and integrate information a lot more effectively.
There we have it. Thank you so much. I want to call you Dr. Satya because you use lots of big words. And
Yes.
everybody listening, have a blessed week.
Thank you.
Bye.